Hello, Bio 130 students, and welcome again to the nervous system for this online experience. This will be lesson 2 in the nervous system. We will cover a few more ways of medically scanning the nervous system. And one such can be, let's look back at the PET scan, MRI, and CAT scans. These are the very standard ways of looking at imaging of the brain. These are the ones that might be talked about more in average day life. And a lot of this information, it's the same that was talked about before, just an overview. Of the three that are being shown, the PET scan is the only one that will give information on the activity of the brain. And, it's the most costly of the one. And if someone is at risk of diabetic shock, the glucose in which the radiotracer is stored, the radioactive chemical is stored, can limit the ability of this technique in certain patients. MRI and CT scans will give physical structure. They will not give information on the activity of the brain, but they will give information on the physical structure. And MRI gives a better image than the CAT scan and involves the use of strong magnets, however, which does mean that it's safer as far as the type of radiation being pumped into the body. Magnetic waves, radio waves. However, the actual physical instruments, it can cause someone to become very claustrophobic. And, a strong magnet is not something safe for a patient who has a pacemaker, among other things. So those might be things that can limit someone's ability to safely have an MRI done on them. And that leaves, a CAT scan, which for someone with a pacemaker, if a doctor needs to get physical information on the brain, then a way of doing it non-invasively without actually cutting open a person's skull is a CAT scan. It won't give the best quality of image, but it is cheaper, so perhaps something to consider for insurance reasons. However, this does involve X-ray radiation, so there is always a risk when it comes to X-ray radiation. Now, let's look at different techniques. One other way of scanning the brain is single photon emission computed tomography, or a SPECT scan. And this is similar to a PET scan. A radioactive tracer, a chemical that releases chemical radiation, is injected, and however, unlike a PET scan, which gives a 2D image, a SPECT scan rotates around the patient's head, just like an MRI. The scanner rotates around the patient's head, taking cross-sections of the radiotracer throughout the brain, and therefore these various cross-sections at different angles can be superimposed on each other to make a three-dimensional image of the activity of the brain. And therefore, like a PET scan, this gives information on the activity of the brain. Now, what is beneficial at the radiotracer? Essentially, what this can do is perhaps certain parts of the body or certain parts of the brain are being more active. Therefore, they're going to need to pull in resources a lot more. Therefore, those parts of the brain might be pulling in the radiotracer a lot in higher concentration. Therefore, more chemical radiation will be detected in those parts of the brain, whereas other parts might not have as much activity, therefore not be pulling in as much resources. Therefore, the chemical tracer might be pulled in significantly less. That's basically what these images show. Now, a healthy brain will show activity throughout the entirety of the brain in a SPECT scan. But say, for example, an Alzheimer's patient, well, plaque proteins form, and these can essentially build up around, ensnare neurons, and cause mass death of those neurons. Therefore, a SPECT scan would show many, say, holes, which in reality are just areas where the radio tracer was not being absorbed efficiently. And if those parts of the brain are dead, well, then they're not going to be pulling in resources. So that's what information can be gleaned from there. And Alzheimer's, it results in a loss in brain volume and also loss in memory. There is also the possibility of, say, a stroke patient, where a stroke being caused from the blockage throughout the body, the blockage in veins preventing oxygen flow. These, with the lack of blood flow, oxygen won't be able to get into certain parts of the brain. Well, neither would the radio tracer, which is giving off the chemical radiation that is being scanned by the SPECT scanner. Therefore, say a stroke patient, it might show parts of the brain that while the brain cells might not be dead, they might not be able to pull in resources, nutrients, the radio tracer. Therefore, that part of the image will show less or significantly less activity. And of course, if allowed to go on for too long, a stroke blockage can and will result in brain cells dying. And, well, can cause a loss in certain bodily functions, like the ability to move parts of the face, the body, the abilities to properly maintain certain organs on your own without outside assistance. Essentially, a SPECT scan, which can be thought of as a three-dimensional PET scan, gives activity information around the entirety of the brain, and it can be used to help diagnose or make sound guesses about what is happening in the brain. Now, another brain monitoring technique can include electroencephalograms, which involves placing sensors around the outer surface of a person's head, therefore non-invasive, awesome, not actually digging into the person's body. Sure, everyone loves that. These sensors then record electrical patterns in the brain, and they're great for diagnosing seizures, epilepsy, convulsions associated with abnormal electrical brain activity. Also for looking at head injuries, say whether certain parts of the brain are damaged, therefore there's inflammation, therefore there's high activity or excessive electrical stimuli happening in that part of the brain, or a head injury causing a blockage resulting in lower electrical activity. Also can be used to look at dizziness, vertigo, or even diagnose insomnia, the inability of someone to sleep for a consistent amount of time. And these are essentially what electrical encephalograms can look like, where a standard normal brain's EEG electrical encephalogram will give off one possible voltage signal Another, say, a seizure-free EEG, someone who may have had seizures and now they're not currently having any, well, their brain activity might have been altered because of the seizure. And then for, say, an epileptic seizure EEG, well, what is the brain like afterwards or during? Things like that. Encephaloelectrons EEGs, they will only give information on the electrical patterns in the brain, which can be used to help infer information on what conditions that patient might be suffering from. Now, those were medical techniques. We'll get into a few diseases of the nervous system, which these are more general terms can be used to describe these, such as typical brain injuries caused by blunt force trauma. Say a football player gets hit in the head, tackled, or someone practicing martial arts accidentally gets kicked in the face. Certain examples of these kind of brain injuries can be concussions or blood clots. Symptoms will involve vomiting, nausea, memory loss, of course, and when possible, treatment can involve physical therapy, teaching the body to use the legs to walk once again, or stimulating those nerves to start moving again, or even speech and language therapy to basically retrain the brain. How does speech and language work? Another disease of the brain or the nervous system can be brain tumors, which is where there are abnormal growths of tissues, but without inflammation. A malignant brain tumor, which is cancerous, or a benign brain tumor, which is non-cancerous. Cancerous being there's uncontrolled growth in the brain tumor. Symptoms can involve headaches from the extra pressure caused on the brain from a mass growing or being present, numbness, tingling, nausea, personality changes due to, again, either pressure or the blockage of normal electrical flow signaling between different neurons that have to, say, take a different route to reach each other because of that tumor. Or even the prevention of, say, certain sensory information, like a family member of mine with a brain tumor near the optic nerve, causing pressure and essentially causing diminished eyesight. Treatment for these will involve surgery, physically cutting out the tumor, which can be difficult because it might involve going deep into the brain, which at that point it may be safer to use actually chemotherapy with chemicals designed to actually kill cancer because it will grow and divide much quicker than, say, other cells, or radiation therapy. There are also neurodegenerative diseases which cause nerves to deteriorate and break down over time. One example being Alzheimer's disease, which appears to be age-related, or Tay-Sachs disease, which is genetic. Symptoms may be the loss of memory or increased anxiety, being prone to apathy, or loss of inhibition, whereas you might normally not do a certain activity. With neurodegenerative diseases active, that loss of preventing yourself from doing that activity might become gone. And treatment, well, often the best case scenario is that medication is used to control or manage symptoms, whereas neurodegenerative diseases, especially those that are genetic, there aren't any real cures, though there is a significant amount of research going into it, and honestly, there is promising results. Maybe in a few decades, maybe in a few years, maybe in a few months. Time will tell. Mental disorders are another way of looking at nervous system diseases, and these are conditions that affect behavioral patterns. Examples can be mental disabilities or disorders such as clinical depression, anxiety, bipolar disorder, intense mood swings, or even one in particular caused by outside stimuli such as post-traumatic stress disorder, PTSD. All very valid, very meaningful mental disorders that require their own appropriate ways of managing symptoms. Well, they're highly variable. One main reason being every person's brain is structurally different to many degrees, and each person's brain is a very unique situation. Therefore, some condition that might cause PTSD in one person might not actually cause PTSD in another person, or to a significantly lower degree. And again, with each person's brain being a very unique situation, treatment can be very difficult, or it can vary as well. And well, medication can be one way of helping many issues. For example, medication that helps with tamping down the stronger negative effects of depression or anxiety, or mood stabilizers to help control manic depressive disorder, causing a more stable midline mood to persist. But also with many of these mental disorders, there's actually a lot of benefit to psychotherapy, which is actually just getting healthy interactions with other people, with, say, pets, dogs, cats, or calling up family members or staying in touch with close neighbors and friends. Things like that actually have such a huge benefit for many folks struggling with depression and anxiety, which during, say, coronavirus pandemic, whereas it might not be safe to physically go to someone's house, it may actually be life-saving to just call someone up or communicate by Skype or through a camera on your laptop or notebook. Psychotherapy is a very valid way of helping many people manage mental disorders. And because each person will be affected differently, whether, say, depression in one person or anxiety will be heavily different than depression or anxiety in another person, especially during COVID-19 pandemic where there's a lot of isolation occurring or diminished social activity. Just maintaining some sort of contact on the phone or whatnot can actually help others knowingly or unknowingly manage these conditions, or in fact actually, say, prevent those prone to these conditions from occurring. For example, perhaps during the isolation of this pandemic, there may be some people who are discovering that they may for the first time be developing anxiety or depression. Well, just maintaining some socially appropriate social distance contact might actually help prevent someone from developing these disorders. And well, that is really the conclusion of the nervous system. There, again, there are many ways to look at the nervous system to study it, and just want to make a very important call to the fact that, honestly, just to focus on that last point, especially during this COVID pandemic where it is beneficial to more at-risk people to maintain social distancing. This does not mean that they should be starved of social interaction. We're in the 21st century. There are phones. There are ways to communicate through long distances, and that can definitely help someone. So, well, yeah. Near the 21-minute mark, this will conclude our lecture material on the nervous system. Catch you all in the next lesson.